Public Health Minister Ratchatha disclosed after the weekly cabinet meeting that although Thailand faces a small chance of seeing an infection of the Ebola virus, the ministry and related agencies have taken precautions to prevent any possible outbreaks within the kingdom. Meanwhile, WHO said the Ebola cases in West Africa will go over 9,000 this week as the epidemic is still expanding in Guinea, Sierra Leone and Liberia.
Public Health Minister Ratchatha disclosed that the cabinet meeting approved the setting up of a special committee to prevent and control the Ebola outbreak. In addition, he said the ministry has been working closely with the World Health Organization and the Centers for Disease Control to stay updated on the matter. Mr. Ratchatha said that the Ministry of Public Health has been approved by the Cabinet to implement 5 preventive measures, including the setting up of a health monitoring system for both humans and animals, monitoring and separating patients in hospitals, preparing diagnostic tools and laboratories, educating the public, and preparing an integrated emergency plan with all relevant agencies. The Public Health Minister urged Thais to avoid travelling to countries which have reported cases of Ebola infections and for Thais returning from such countries to seek medical attention within 21 days of arriving in the kingdom. He congratulated Sirirat Hospital for having made notable progress in the search for a vaccine against the deadly disease. He noted, however, that the drug still needed to pass many tests to prove its safety and effectiveness. Minister Ratchatha also warned the public against panicking over rumours of infected patients in the kingdom, while reassuring that the ministry would keep the public informed on the matter at all times. Meanwhile, the Department of Health Service Support has held a training session for private hospitals on how to detect and treat Ebola patients. Its objective is to be prepared for an outbreak, which is unlikely. The department said there are a few hospitals that fail to comply with the standard procedures when treating patients suspected of having Ebola. Although there is no report of patients with Ebola in Thailand, the Ministry of Public Health is taking no chances. Medical personnel in private hospitals in Bangkok have recently been trained on how to contain and detect the fatal disease. They have also been instructed to follow the standard protocols, which include abiding by the safety procedure if any patient is treated for Ebola in their hospital, monitoring the global outbreak, and identifying ways to prevent the spread once the patient has been admitted. People are encouraged to call hotline number 1442 to report to the Department of Disease Control if they run into anyone with suspicious symptoms. As for the situation in Africa, the World Health Organization said yesterday the number of Ebola cases in West Africa will go over 9,000 this week, and the epidemic is still expanding geographically in Guinea, Sierra Leone and Liberia. The Assistant Director General, Bruce Aylward of WHO, said the death toll so far in the outbreak, first reported in Guinea in March, has reached 4,447 from a total of 8,914 cases. While there are signs of rates of infection slowing in some of the worst hit areas, the Director General Aylward said that the disease has now reached more districts, counties and prefectures than it had a month ago, and said case numbers would continue to rise. He also stressed it would be really premature to read success into the apparent slowing numbers in some areas, adding that by the first week in December, WHO projections suggest there may be between 5,000 and 10,000 new cases a week.